everybody.
Hello.
Hello. We are here to listen to Yolanda Goff today, and she's going to be talking to us. She's a wellness expert and healthcare business developer. I guess you can read all that. She's with HCPN Alliance, which is a multi-million-dollar health management group. She's worked with the implementation of antioxidant testers since 2007, and as an advocate for marijuana, Yolanda has successfully bridged the importance of nutrition along with cannabis therapy. Her motto is, let your food be your medicine, and your medicine be your food. She also stands for early diagnostic information, allows for the possibility of preventative intervention. I bring you Yolanda.
So Laura, thank you very, very much. Okay. I generally speak loud enough that I don't need this, but we'll see. Sometimes I'm kind of a hand person. I'm all over the place. But thank you very much for being here. I want to thank Martha for all the work that she's done with this conference. This is my second year attending, and I plan on being a long-term exhibitor here as well as attendee. I'm very excited about the scientists. First of all, I'm a wellness expert that's very passionate about science. I'm a recovering pharmaceutical rep, not a doctor, but I love the science that's behind the medicine. So Pharmanex is the company that I represent. It is next generation pharmaceuticals. It's important to every doctor that I talk to know about the science. And I don't think any of you in here are any different. The science is very important. So what drew me to this company was the fact that there are clinical studies. Because coming from that pharmaceutical background, it was all about the studies. And that is important. So one of the things with this company is people think, well, why do we need to know about supplementation and nutraceuticals? Your patients are taking them whether you're recommending them or not. They could be shopping at GNC, Walmart, or Vitamin Shop, wherever. And it's important to know that a dietary supplement basically does not have to be proven safe by the FDA. And it's not until something happens, whether a person has some type of adverse reaction, or they find out that what is on the label is actually not in the bottle, before there's any type of the FDA does any type of claim on it. So basically, in the marketplace, there are so many supplements out there, and I know that some of the doctors that have integrated our program have had actual cases where patients wanted to know about a particular supplementation. The doctor said, I don't know about vitamins, take whatever you want to take. Patient goes out, does their own research, and what we patients do is Dr. Google. We do that. And then what happens is there's some type of adverse reaction. This particular patient, the liver was damaged to the point that there was death, and the doctor took it very seriously because the patient did come, asked about what should I take. Doctor said, I don't do any supplementations, take whatever you want. And that got Dr. Amy Matecki out of California very seriously thinking about this company and the products. And in California, we now have one of the first integrated hospitals that have integrated the technology. And we're very excited about that. And anything that I'm saying to you, of course, I definitely can back it up with the science, with the recommendations from any of the doctors. So I'm not going to say things that I don't really know anything about. And I don't know everything. 4 major retailers, Walmart, Target, GNC, Walgreens, and this was just in I was going to say 1915, but 2015, I don't know why my mind went to 1915, that this happened, so 3 years ago. And here, you know, these stores, people think they're reputable stores. Why would our government allow this? Well, as I showed you earlier on the slide, the law does not do anything regarding dietary supplements. So it's important for you and your patient to know what's on the label is actually in the bottle. So concerning our company, Pharmanex was actually started by these 3 scientists. There are some peers that I hope that maybe a couple of them you know. Michael Chain, PhD, former Deputy Director of Medical Chemistry at several pharmaceutical giants. Dr. Joseph Chain with Wyatt. He also is very well known for the Rapamune, the drug that helps with organ transplants. And Dr. Carl Jurassic, we all know, if you know about the birth control pill, that is what he invented. So here we were a startup, science startup company. And that was the focus of these guys. They were all about the science. And in 1994, they raised $46 million from these investors here that I'm sure you know, Fidelity, Whitney, and Pritzker. 1996, there was a development breakthrough with colistin. And these guys knew that, hey, we can go out and do this. We can provide a supplementation that is going to work, and they were very successful with it. They were able to launch 5 products in 38,000 stores. And so you think, well, why didn't they just continue to stay in those stores, the Walmart, the Walgreens? So one of the things that Joe Chain, and I have kind of a nice little personal relationship with him. He is the Chief Scientific Officer of Pharmanex, and I've gotten to know him very well over the last 11 years. He said one of the things that happens when people go into the store, they look at a product by 2 different companies, and they make a decision based on price. And I'm just going to speak on a particular supplement, echinacea, just because a lot of people will use it for colds and whatever. But an echinacea that's $3.99 and one that, say, it is $19.99, just looking at it, your consumer really doesn't know that the $19.99 could be from the root, and that root is more potent, it's a better product. They may have done different testing on it, whereas the $3.99 is just the leaf. And those are some differences that consumers don't really think about. I'm a consumer. Believe me, I didn't think about that. I would have been going for the $3.99. And as I've been in this industry, I myself have become more educated. I like knowing that what is on the label is in the bottle. That is important. So a little bit more about our company. We have a 34-year track record. We are in 53 markets. We've done over $1 billion in R&D. And that's very important when you think about the technology. And I ask that each of you come out to the booth and have your own antioxidant score tested. See what your number is. When I speak with people about this test and the device, it is no different than any other biomarker. So we get our blood pressure. We know that if your blood pressure is 140/90, you may be feeling great, but you could be really in the danger zone and something seriously going on. Again, we have those biomarkers because we know that it is important. And again, there is science behind the technology, and this biomarker is really a true biomarker, and I'm going to continue to show you a little bit more on that. These are some of our research affiliates. As you can see here, Harvard, Berkeley, Scripps, Columbia, Yale. There's a Yale study, and another thing that I'm also sharing is that we have over 81 clinical studies. Any of you that are interested in the science, want to know more, want to dig down deeper, I will gladly send you a link, and you can look at as many studies as you'd like. They aren't studies that Pharmanex has done. These are your peers that have done these studies. And one of the ones that I really like for healthcare professionals to take a look at is the Katie White paper. So again, we have over 28 research affiliates, including top universities. World-class scientists in 14 disciplines. Here we have just 9 of the disciplines that, listed, but the company is a science-based company. Dr. Lester Packer is considered the father of antioxidants, no different than I consider Professor Raphael, I hope I'm pronouncing his last name correctly, Meshulam. Thank you. I always have to look at it to say it right. It's one of those words I need to look at. But I consider him the father of the endocannabinoid system. And so one of the things I remember in the early days with this technology, people hadn't heard of Lester Packer. They didn't even know what antioxidants were, let alone this device. And I'm hearing the same thing now. I have doctors have no idea what an endocannabinoid system is. We all have it. And so we know that there's always going to be new technologies, new discoveries, new innovations, constantly expanding. Medical science was different 100 years ago, and it's going to be different 100 years from now. It will be even bigger and better. So Lester Packer says that this technology validates his life's work. And I think that is a highly well-stated statement. These are the 2 inventors. So Dr. Gellerman and McLean, they do not work for our company. They received a grant from the National Institute of Health to work on age-related macular degeneration. We know that behind the eyes there's a lot of antioxidants, and that's what they were measuring. And it started out being a retina measurement. And one of the scientists accidentally had their hand in front of the device, and from there we were able to find out that a hand scan is sufficient. And a lot of people ask, well, what is the science behind it? And this is the science. Blue light goes in at exactly 473 nanometers. It's a shift that happens. The green light comes out and gives a number, and that is at 510 nanometers. I am not a scientist, but I know a lot of you know about Raman Spectroscopy. It is Nobel Prize winning science, over 70 years old. So going back to talk about the inventors, and this gives a little bit more information about what they were doing. And the initial study was on the Raman imaging of human macular pigments. And again, like I said, they were measuring the antioxidants behind the eye. And this is how they were doing it with the retina. So this goes over a little bit of the evolution with the technology. So we started in 1922. That was the initial discovery, with seeing that every cell in the body can be measured by a certain wavelength of light. We know that. He won a Nobel Prize. We moved forward in 1999. The first scanner device was developed at the University of Utah by Dr. Gellerman and McClure. It was as big as a ping pong table. So in 2002, they got it down to a portable size, but it was still kind of funky looking. Then in 2003, we actually had something that, looked more like a device that we can move into the office. But believe me, this thing was clunky. It took 30 minutes to calibrate it. It would go off. If the office was too cold, too hot, So we still needed a lot of improvement then. By 2005, we won a business award. By 2006, the S2 was launched. I came on board in 2007, and as you can see, in 2009, we continued to up the edition with the Everest edition. It had been on Mount Everest. We wanted to be able to control temperature with the device. So, sometimes it gets cold here in Denver, right? I might leave that device out in my car. I'll know that it will still crank up and work and scan and be accurate every time. And in 2013, we came up with another design. I've often heard our scientists say, as we continue to work with this device, it may one day fit into the pocket of our physicians. So who knows how small it will eventually be? We don't know. But here we are in 2015, we won an innovation award for this device. 30 seconds, we can give you a fast, accurate measurement that is definitely more accurate than blood serum testing. And so with that, we have a quick test. It's battery operated, it's wireless. I've been on a plane and I'm sitting there talking to people about where I'm going. I'm going to Denver and what you're doing, and I'm going to this marijuana conference, and everyone's talking about marijuana, so it gets that conversation going, and then I add in a little bit more, and next thing I know, I'm testing somebody right there on the plane at 30,000 feet up. And it's very cost effective, because to get a blood serum testing will cost you $500 to $1,000. That's not going to be cheap. And many of my physicians that have integrated this decide what's best for them. I have physicians in New York that are charging $70. I have other physicians that are in New Jersey because they want every patient to be tested, and that is the best thing, not to pick and choose patients, and they say $5 because it is important to them. So I give you a range because it does depend. It is your wellness practice, and we work with you on where you want to. I have a doctor in Georgia, he does 70, and he says, what I want you to do is get a baseline, you go on product. In 2 months, because the company guarantees that the score is raised, we want to see a higher score, that's the better than a lower score, or your money back. And this isn't paid out of your pocket, it's paid out of the company's. So he gets his patients on product, he's raising their score, their health is improving, they're doing better, and he reimburses the 70. So it's how you want to do it. We work with you with how you'd like to integrate it into your office. Here, just to let you know, it's been accepted already by the scientific community. The New York Academy of Sciences, the Gordon Research Conference, the American College of Nutrition. The list goes on and on of the scientific academies that have embraced this technology. This is the best piece of the slide. This is the pack. This is my favorite thing to talk about. This method and apparatus provide a non-invasive, rapid, accurate, and safe determination of carotenoid levels, which in turn can provide diagnostic information regarding cancer risk. I never say that this is a diagnostic machine. It's a measuring device. It is a nutritional lie detector. You can tell me all day long, I'm healthy, I eat well, the proof is in the pudding. Okay, you can think that, well, my blood pressure is great, my cholesterol is wonderful, but until we get a measurement, there is no science. We know that there has to be a measurement. When you can measure it, then you've got science. And such an early diagnostic information allows for the possibility of preventative intervention. Now, as doctors working with your cancer patients, we know we like to really just prevent it. We like to prevent a lot of disease. And you have to make the decision, you know, how you want to play in the game. We all can play however we want to play in the game. I am on the preventive side, and I think a lot of us are on that preventive side. But when we do have people that have that diagnosis, and maybe it's not always cancer, it might be cardiovascular disease or diabetes. I mean, it could be a number of things. What I generally see is that across the board, antioxidant health can work with it all. Knowing that the endocannabinoid system and cannabinoids work with it all. That is another antioxidant network. And so, again, you as the healthcare professional, you make that decision for your wellness practice. I'm just going to let this kind of sit here. It speaks for itself. We definitely have won some innovation awards. I know that the Stevie Award is kind of like the Oscars in the business sector. Some people don't realize that. I never knew that till I was with this company, you know. I never heard of the Stevie Awards, but it's a pretty big deal. A lot of people don't like Dr. Oz, and this technology has been there. He is a licensed cardiologist. Measurement makes markets. We talked about blood pressure, cholesterol, and of course, blood sugar, A1C levels. Money is being made in these markets. Money is going to be made in the cannabis market, and money is going to be made in antioxidant health. I want to just run through some things really quickly. I talked about this being a biomarker, and I've got to go a little bit fast, and I want you to, if you have questions, come to the booth. So I mentioned that this has been at Yale. We have a Yale study, and I'd love to send this to you by email if any of you are interested in the complete study. Now, everyone's talking about cannabis, but we're talking about nutrition as well, but who's measuring it? It's not about, well, this helps so-and-so, but we're actually doing measurements. And so 60 to 70% of your patients are already consuming nutritional supplements from somewhere. They're getting therapies. And this just goes to show you some of the things that, why they're taking those supplementations, what health condition. We have medical grade supplementation that is in the physician's desk reference. If that is important to you, these are some of our products that are there, and we do have a multivitamin as well as some targeted things as well. Thank you. Thank you so much for your time. I appreciate you, and if you want to know more about Pharmanex, that is why I'm here at the MJ for MD's conference to share with you this weekend. Thank you so much.
Thank you.
You are welcome.